it seems that we had a headline recently about how Governor DeSantis had reported that about half of the hospitalizations due to the virus were actually people who were vaccinated. And so there's these questions right now about the efficacy of the vaccine. There was a Politico article saying that the data that isn't published yet from Israel is suggesting that the efficacy of the vaccines is becoming less to some extent. What are folks to make of this?
Sure. So the vaccine story is somewhat complicated, but basically the vaccines have shown the following. Long term, they have been so far, I mean, we're only, say, eight months into the vaccine era. Long term, the vaccines have been highly protective against death. Over 90%. And I'm looking at the data from Israel. I'm looking at the data from the UK. Frankly, I'm to the point where I'm skeptical about the data coming out of the CDC, frankly. I hate to say something like that, but I look all over at the data now. I don't just blindly accept CDC data. They've been erratic in what they've said, and I think we have to, we trust who we trust for a reason. So I look at the Israel data and the UK data, and we see very good protection of the vaccines against death even now. There is no real evidence of serious waning of protection against death from vaccines. That's point number one. Point number two is there is evidence that people still, that the protective effect against symptomatic illness decreases over time with the vaccines. And that is true when looking at the data from all over the world. And so, yes, you can get infected even if you're vaccinated. Yes, a certain percentage of people do get serious illness, but it's still highly protective against death. So that means what do we do about the durability of the immunity with vaccinated people? Because we're interested in protection and we're interested in durable or long-term protection. And we know the following. Number one, protection against the illness is more robust and more durable, longer lasting from a natural recovery after the infection than it is from a vaccine in an uninfected individual. That is factually true and inarguable, although people try to distort that. And why do I say that? Because of the data. The data is very good from Israel, that shows that there's a 13-fold to 26-fold, meaning times, more symptomatic cases in people who have been vaccinated but never infected, when they get eventually infected, versus people who have had an infection in the past, never been vaccinated. They are more protected. And we never hear about this from the people who are mandating vaccines and everybody blindly saying that everyone must get a vaccine without regard for the natural immunity. And this is a huge public health not just error, it's a disgrace, really, that our CDC and our White House leaders of task forces are not talking about basic immunology. We know this is true for other viruses. We know it's true for SARS-1. 17 years after people who have had SARS-1, we look at their blood samples and it has still robust immune response to SARS-2. That illustrates a cross-protection sort of mechanism, but the point is 17 years later. We know from Spanish flu, 90 years afterwards, we see people have protection against that virus, an immune response. This is not new ground. This is not something that's shocking. It would be shocking to think that people who have recovered from the viral illness do not have long-term protection. That would be the shock. And everybody who's a credible scientist knows that, but somehow we disregarded all the information that we used to know. So we see there's another point that I would like to make about the measure of the protection. Antibodies decline after an infection over months, typically. That's common. That's not a cause for alarm. We don't give a booster shot or a vaccine just to we don't do that on the basis of antibodies. We do it on the basis of protecting somebody from a serious illness. We're not sitting there proudly displaying our antibody levels. We want to make sure people don't get sick. And when we look at that, that concept, we always seem to forget, or we don't forget, I don't forget, but the press and some of the most visible faces of public health on TV never educate the public about something very important, which is that when your antibodies decline after 4 months, 8 months, whatever it is, that does not mean necessarily that your protection is gone. So, because you have a long-term immune system in your body. This is not new. This is medical student first year college really level science, is that you have stored in your both T cells that people have talked about, as well as memory B cells that are in your bone marrow that provide protection for years. And there is evidence that this virus has shown that. This is not, it would be a shock if it didn't. So, you know, there's just a lot of misinformation again, and a lot of incomplete information, a lot of hysteria being unfortunately promulgated by people who should know better. If you don't know this stuff, you shouldn't be in the CDC. If you don't know this stuff, you should not be advising the President of the United States. And if you don't know this stuff, you certainly should not be on TV talking to the American public.
At least among the people I'm speaking with, there's an understanding, and you've already talked about this to some extent, that the vaccines, you cannot count on the vaccines to prevent infection. You cannot count on the vaccines to prevent transmission of the virus. But how does that work exactly? Because there's initially, once you get the vaccine, there is some protection from infection, but it seems to wane pretty quickly. I'm wondering if you could kind of unpackage this whole picture for us.
First, we want to make sure people understand the vaccines do protect against infection compared to people who did not get a vaccine. They do. And I want to make sure people understand what has happened here, in my opinion, in the discussion about the vaccines, is that there's been so much pressure and so many erroneous statements made trying to force people to get vaccinated that there's a too strong backlash against the vaccine. The vaccines are good. The vaccines are protective compared to people who didn't get the vaccine in terms of getting reinfected or getting an infection. But yes, it's true. It's not perfect. It's not 100%. It's in fact, in the Israel data, only 40% protective at some point in months and months later against all infection. So, but that's not to say that the vaccines are not good. They are very good. They are protective, and most importantly, like I said, they're protective against hospitalizations and deaths. The vaccine protection wanes over time. We've seen this in the studies in Israel. We've seen it in the studies in the UK. I saw some data yesterday in the Netherlands that showed similar sort of waning. And okay, so we don't have experience. I think we should start by saying this. This is the first mRNA vaccine that's been used, to my knowledge. This is a new type of technology here. And so we don't know the long-term efficacy of these vaccines. And by the way, we don't know the long-term side effects of these vaccines because they've not been used long-term. But we see that the protection against all infection and against other things like the load of virus in your throat is imperfect, and it wanes over time. But again, we keep forgetting the bottom line. The bottom line is we are concerned with the serious illness. We don't walk around checking people's throats for what bugs are in your throat. And I'll tell you why. Because you're walking around with the bacteria in your throat that causes meningitis. Okay, Neisseria meningitidis. You're walking around with certain forms of streptococcus in your throat that in certain settings causes disease. We're not there to sterilize people's nasopharynx. That's not the goal here, and anyone who thinks that needs to see a psychiatrist, frankly, and they shouldn't be advising people on this vaccine. What we are in favor of, our goal is to, again, to stop the serious damage, to stop the death. So the endpoints here have to be understood. Today I see some noise about Pfizer saying that the vaccines are safe and effective in children. And when you look at that, this is an example, I'm sort of taking off from what your question is, if you'll excuse me, but when you're looking at, they say they're efficacious, well, they didn't even examine anybody who didn't get the vaccine, so they cannot calculate efficacy at all. That's just simply not possible. They measured efficacy, it seems, although I didn't see the data, but from the article, it seems they're talking about they measured antibodies. Okay, they got a vaccine, they got a drug, they injected it into kids, and the kids mounted an antibody response. We're not, again, that's not the right endpoint. The endpoint is protection from serious illness or death. That's the endpoint. So A, they didn't measure that, and B, these kids, unless you're severely immunocompromised or have a disease like leukemia, a child does not have significant risk from this virus. So you have to wonder, how can you measure efficacy for a vaccine against a disease that has no significant risk in these subjects, in these patients? I just think we're mismeasuring the endpoint here, is the long-winded answer to your question. The waning protection cannot be based on a test for antibodies. The waning protection must be, are you protected against the serious consequence of the illness?